I'm Dr. Saravanan, consultant neonatologist and pediatrician at Rainbow Children's Hospital, Bannerghatta Road. Usually, parents have the entire family to support them during the birth and care of newborn. But during this pandemic, first-time parents are alone with the newborn. That's why we at Rainbow thought that we will have this session on KGF, that is Kids Growth Facts. Most parents are worried about their baby vomiting. Is vomiting in a newborn baby a concern? Well, all newborns spit out or vomit a little bit. It's quite common. Now, we call it as gastroesophageal reflux. We also call them as happy spitters, where baby would spit out a little bit of curdy milk, which is quite small in quantity, and just they keep spitting it out. But the baby would be thriving well and would be gaining weight adequately. Now, reflux can be prevented by adequate burping and also holding the baby propped up for about 30 minutes after feeding and giving shorter and more frequent feeds. Then, when should we get worried about vomiting? Well, any vomiting which is green in color is definitely a concern. Any vomiting which contains blood or brownish in color, you have to meet a doctor immediately. Any vomiting which is projectile, which is forceful and has large quantities, could be a feature of hypertrophic pyloric stenosis. Well, this happens in boy babies, and usually these babies vomit and they are always thirsty and anxious. But what is the clinching here is that these babies do not gain weight. So whenever your baby is not gaining weight adequately, a rough number is a newborn baby should double its birth weight by 3 months. So if your baby is vomiting and not gaining weight, definitely it is a concern. And last is, if your baby is vomiting and is also dull or has fever, this could be an infection and you need to meet a doctor immediately. In short, reflux or mild spit-ups of curdy milk is quite common. You need not worry as long as your baby is gaining weight adequately.